because bad things can happen if you're not a good candidate. I describe it typically as layers of a cake, so you can think about it as the layers of a cake. Then liposuction is not going to give you the result that you are looking for. How do you know that? Even with a consultation, it's hard to tell exactly what is 5% is contributed to this, 20% is contributed to this. Are you too old for chin liposuction? It's a very common question that I get asked, and it's really important to understand whether you are a good candidate or not a good candidate for this treatment, because bad things can happen if you're not a good candidate. So if you like this type of content and you're interested in the overall surgical experience, then like and subscribe for more. All right, so let's get into the nitty-gritty details of what makes you a good candidate or not a good candidate for chin liposuction, and why age, although it is just a number, is important. Let's explain. So basically what ends up happening is as we get older, in general, there are changes that happen to our neck that lead us to not be as good of candidates for chin liposuction and make us better candidates for other procedures. It's critical that you understand this because I really don't want you or any of my patients to have bad outcomes and to be disappointed with their choices in having these procedures. So let's jump into that. So there are many different reasons that you can be a bad candidate, but it all starts with the anatomy. Like I said before, age is really just a number, and it's more about your anatomy than anything. And that's why a consultation, I will say again, a consultation is key to make sure that you're a good surgical candidate for chin liposuction. So when I describe the anatomy for the neck and describe the anatomy for chin liposuction, I describe it typically as layers of a cake. So you can think about it as the layers of a cake. So the top layer is the skin. Underneath the skin is a layer called the subcutaneous fat. And that is the layer where most people may have a little bit of extra fatty tissue, also called the double chin, in this area. That layer is the layer that can only be treated by chin liposuction. That is the fatty tissue that is contoured, suctioned out, and removed by chin liposuction. Any of the other layers of the cake are not addressed. Partly addressed, but really they are not specifically addressed. Underneath that subcutaneous fat layer is the platysma muscle. The platysma muscle is a hammock. Basically starts from one end of the neck, extends to the other end of the neck, starts at the clavicle, and actually moves into the face and becomes the SMAS, which is, you may have heard about that during facelift surgery. So this muscle essentially separates the superficial layers from the deep layers. And the deep layers are the other contributing factors that can lead to fullness, heaviness, laxity within the neck that are critical to evaluate to make sure that if they are contributing to the heaviness that's seen within the neck, then liposuction alone is not the right answer. So underneath the platysma muscle, one layer down within that cake, is several different structures. You have your submandibular glands, which are salivary glands. We all have them. They're paired salivary glands underneath your chin. They secrete saliva into your mouth. There's many different salivary glands, but they can be one of the contributing factors to the fullness in your neck. The other thing is your digastric muscle. Your digastric muscle is one of the muscles, it's the floor of your tongue actually that stops in the neck. And that muscle can sometimes be full, enlarged, hypertrophic, and that can contribute to fullness under there. There's also additional fatty tissue underneath that platysma muscle that can contribute to fullness and heaviness within the neck. And that's actually typically in excess for most male patients. And that's why liposuction in some male patients can't achieve as incredible of a result as it can for female patients because of that fatty tissue that's underneath that muscle. So those are the layers of the cake. That's the anatomy that's important to understand. And now let me explain why age and anatomy together can decide whether you're a good candidate or a bad candidate. So if you have laxity in your skin, laxity in your muscle, heaviness in your submandibular glands, heaviness in your digastrics, heaviness in the fatty tissue that's deep to your platysma muscle, then liposuction is not going to give you the result that you are looking for. How do you know that? Get a consultation. I will tell you also that it is sometimes hard to predict which one of those anatomic structures is contributing to the fullness under your chin entirely. It's oftentimes a combination of a lot of different structures that contribute to this fullness. So it's even with a consultation, it's hard to tell exactly what is 5% is contributed to this, 20% is contributed to this, 50% is contributed to this. It's very hard to predict it. And it's mostly just kind of by experience, by your age, by an exam, and many other things as well. So that's important to understand. And it's not a perfect science, but it's definitely critical to get that consultation. So if those other structures are contributing, and those structures tend to get more lax, more loose, more heavy with age, then liposuction, like I said, is not the answer. A surgical neck lift or a deep plane neck lift or even a facelift, depending on your age, is probably the right choice for you. That allows me to get access to those structures, remove excess skin, tighten the platysma muscle, trim down the salivary glands, trim the digastrics, remove any of the fatty tissue that's underneath the platysma. I can do that under direct visualization through a small incision underneath the chin, as well as incisions behind the ear or sometimes in front of the ear if we're doing a facelift. And that allows me to achieve and get that really beautiful, natural looking result for the individuals that have those anatomic issues. So it's key to understand what your anatomy is and how age can contribute to the changes in anatomy that you can have. So in general, I will say individuals between 20 to mid 30s tend to be very good candidates for chin liposuction. The majority of the fullness, heaviness in their neck is caused by excess fatty tissue just underneath the skin, the subcutaneous layer. As we get older, skin laxity, muscle laxity, glandosis, fatty tissue, deep fatty tissue tends to contribute more to those structures. So late 30s, 40s, 50s, and 60s, you have to start thinking about whether liposuction is actually a candidate. So, or it is a good treatment for you. So I hope that makes sense. It sometimes can be a little bit confusing. It's obviously a anatomy lesson, but the biggest recommendation that I can say is get a consultation, see someone that does facial procedures, neck procedures, liposuction frequently that can help you and give you the best possible outcome. So if you like this type of content, then like and follow for more, leave comments and questions below, and I can't wait to answer all of those questions. And I look forward to seeing you guys next time.